We are going to be starting with Chapter 7, the lymphatic system. And this is also can be the same as the immune system. It works together. Now, on your fadavis.com, you've got the ebook. And for those of you that don't want to use your textbook, you can go to the ebook. Also, in your medical language lab, on the reading part of your assignments, that has the whole chapter in it. Reading this chapter in that and in any of these resources is what's important. And please do not look at it because, oh, I'm not getting a grade for doing the reading. The reading helps. The reading helps you do better on your scoring on the whole module of the F.A. Davis. So please don't take it for granted that, oh, I don't need to do that because I'm not getting a score for it. You are. Everything comes down to it. You have to know what you're reading about and how to do the exercises, okay? So also remember, since the holidays are over with, due dates for these assignments are due on the date. No, there's no extensions, and you will receive a 0. And if you have any questions, please let your facilitator know, your instructor, or myself, okay? So anyway, let's get on to the terms of the lymphatic and immune system. Some of this we've already had, okay? So, but I want you to go through it. This is going to be, it's on one of your assignments. Lymph, urea, lymphatic vessels, lymph nodes, phagocytes, phagocytosis, metastasized, lymphatic system, superior vena cava, neck, axilla, groin, and abdomen, tonsils and adenoids, thymus gland, T lymphocytes, and spleen. The lymphatic system is like a network, and it works with the circulation system. So when you'll see some terms that we've had in the cardiology part being referred to in this lymphatic system. So when your blood is circulating through your body, you know, it goes out the arteries, it goes into the arterioles and into the capillaries. Well, in the capillaries, fluid leaks out, and the fluid is this clear, odorless fluid called lymph. And it is circulated through the system, and then it comes back out. It goes into the interstitial tissue. And interstitial is a space that's in between the cells. And so you've got this tissue, and then it goes back into the veins, and it is circulated back up into the heart. But the way it moves back into the circulation system is through muscle contraction, and it's the smooth muscle, and it's skeletal muscle also. And so your muscles contract, and this is what takes it back up to the heart. So the function of the of the capillaries, of the lymphatic capillary system, is it returns the fluid back to the heart. It helps large molecules like the hormones and the lipids and the red blood cells. They're too large to go through the capillaries. And it also helps with keeping watch out for your immune system, for infections and for inflammation. So it's really, we've got the lymphatic system throughout our body, and you'll see it that it's, we've got larger parts of it, like up in the neck area, the axilla area. So we're going to investigate and go into more of this, because it is the whole lymphatic system of how it works with keeping our body in homeostasis. If If it's not able to drain the fluid very well, things like conditions like CHF, the fluid also builds up in the body and other parts of the body. And people that have, like women who have had these radical mastectomies in the past, they've had the lymph nodes and the lymph glands all removed, like in the arm. And so you see them with swollen arms, and you may have family members that have to wear a stocking over that arm, and that's a compression stocking. So just to refresh, capillaries are blood that comes from the arterioles and enters the capillaries. O2 and nutrients leave the capillaries and enter the tissues and cells. Capillaries receive CO2, which is carbon dioxide, and waste products. And some of that waste products is also called urea from the cells and tissues via the lymph system. Then the lymph is fluid leaked out from the capillaries into the interstitial fluid between the cells and tissues. Lymph capillaries pick up fluid. Lymphatic vessels have also one-way valves, like in our heart. Remember that in the veins and the arteries, it was all one-way valves. So in our lymphatic system, you hear this one element of the lymphatic system called lymph nodes. And so lymph nodes are what they use them for diagnostic procedures when somebody has infection and they need to know what it is. And if it's lymph involved, then they take a lymph cell or lymph node. And these nodes are kidney shaped. So they're just like a bean, which is like your kidney. And it's got these vessels that come into it, and they're called afferent because the fluid comes into the lymph node. But then it's got two vessels that come out that are called efferent, EF, because it brings the fluid out of the node. So you've got, because the pressure builds up in that node, and then it can force out that fluid. So it's we've got the lymph nodes and the lymph glands all through our body. It is our tonsils and our adenoids are their lymph glands. They are up in our of course in the oropharyngeal area. We've got the lymph nodes and the lymph system throughout our neck. We've got it through like I said, the axilla area. We've got it down in our abdomen, in the groin area. And this network, the lymphatic capillaries, is all throughout our body. On the lymph node, the outer part, like the kidney, is called the cortex. And then you've got on the inside, it's like also the kidney, it's called the medulla, which is in the middle of it and all. And they've got it quite pretty how they've got it diagrammed here. But remember, afferent vessels bring fluid in. Efferent brings fluid out. So some of the important parts of the lymphatic system, this involves the immune system, like I said. So we've got in your white blood cells, and we all know what the function of the white cells are, right? They help with the immune system. So you've got these specialized white blood cells called phagocytes, and I call them the buzzards of the circulation system. And because they clean up, they come up and they clean up debris, they come in and they take care of these nasty old infections, the bugs that come into our bloodstream, and the lymph has killed it. So the act of killing the act of killing the debris or the viruses or bacteria is called phagocytosis. So you've got these, it's amazing how with the immune system, how it comes in and takes care of our bodies like that. The immune system is part of the lymphatic system. When infection or inflammation penetrate the body, that is when the phagocytes kick into play. The lymphatic vessels rely on the contraction of skeletal and smooth muscles for pumping the fluid through the system and back to the circulatory system. The superior vena cava, lymph enters the circulatory system and combined with the blood. So remember what the superior vena cava was, okay? That was that main artery up here. There's the superior and there's the inferior. Some of you may have had your tonsils and adenoids removed when you were just little kids. They get inflamed and they start causing ear infections and really bad sore throat infections. And you've got 2 sets of them. So I think in the recent years, the insurance companies have dictated that, we'll just have you remove the tonsils first. And if that helps, then you don't have to have the adenoids taken out. And there's many of us question that because you're putting the child through 2 surgeries, and most of the time they have to come back and have those have the remaining tissues removed. So the surgeries are called tonsillectomy and adenoidectomy. And in the hospital, we call it a TNA. So some more terms: lymphitis or lymphadenopathy. Inflamed gland, which if chronic may need to be removed surgically, for example, the tonsillectomy and adenoidectomy. So either one of these words, it means the same, inflamed, okay? Some axillary glands may need to be removed for diagnostic reasons to determine if cancer has metastasized to other areas of the body. So metastasize is spreading to other parts of the body. And so this usually, when they go to look at it, they always look at where the primary site was for the cancer. Because like prostate cancer spreads to the bones. The breast cancer spreads to the lungs, to the brain. And so if they say, okay, she had breast cancer, say 20 years ago, and now she's got colon cancer, it's probably not the same cancer. But so much of it now has changed, but most of the time they look at where the primary site was. So lymphedema, when lymph nodes are removed from the axillary area, the lymph fluid builds up, like I said, and women and some men that have had to have mastectomies, they have to wear a compression stocking. But one thing, that even though your tonsils and adenoids are lymph nodes and there's lymph glands in there, you don't get that type of swelling. Another lymph gland is the thymus gland, and we don't hear that much about it. It develops prenatally, and then as we get older, and when we get into our senior years, that it's usually very, very small. So the thymus gland is located mediastinum above the heart. So it's about right in here. There's 2 lobes, again, like the kidney and the lymph node. It's got the outer part, which is called the cortex, and this contains T lymphocytes, which are white cells. And then the middle part, the inner part of the thymus gland, is called the medulla. The thymus gland is most active during prenatal stage to puberty. It then gradually shrinks. So you wonder, this is to help with your immune system. So think about it. When we get older, we don't have the immunity like we used to. So that's probably because of that thymus gland not being prominent like it was when we were younger. It plays a role in immunity and against cancer also. T lymphocytes are called killer T cells. They seek out and destroy harmful cells. I call them the snipers of the white blood cells. They mature in the thymus, then circulate in the spleen and the nodes. So these T lymphocytes are good cells. They come out and they kill off the bad stuff. The spleen is an organ that's in the left upper quadrant of your abdomen, and it's under the ribs. And it's dark red, and it's an oval shape. So during prenatal, the spleen forms red blood cells and white blood cells. Postnatal, the spleen produces red blood cells only in case the body needs an emergency. The spleen continues creating white blood cells as well as antibodies as part of the immune system. It stores a supply. It's a storage unit, and it keeps like 100 to 300 mLs of blood. 30% of the body's total platelets which are important for blood clotting. So this is an important organ. So what do you think happens when you don't have a spleen? Think about it. If it doesn't have that storage unit of holding blood and also for the platelets. So think about what happens then. What do you have to be cautious of? Splenectomy is where they remove the spleen. Now, they remove it because you've got internal bleeding, okay? And again, that has to do with the blood clotting in there. So you've got all these platelets coming out and it's bleeding and it's causing hemorrhage. So you've got to take it out. Your spleen also enlarges when you've got mono. And so it's best not to get involved with like contact sports like football, soccer, that sort of thing, because if you get hurt in there, you could rupture that spleen. We are going to get into pathology terms now, and this is all linked in with the lymphatic and the immune system. One of the important pathologies that we deal with in our immune system is AIDS, HIV and AIDS. AIDS is not, it's not synonymous with HIV, okay? It's the late stage of HIV. So someone can be tested for HIV and be positive, but they don't have AIDS, okay? So keep that straight. AIDS has other involvement with pneumonia, with skin cancers. It's really sad. And when they start getting sick and sicker and sicker and body wasting, that's usually the AIDS part. Autoimmune hemolytic anemia. This is an immune system mistakes RBCs, the red blood cells, as foreign and creates autoantibodies that attack them. So your body is fighting itself, okay? So that's an autoimmune disease. And that is the EBV, that is lymphoma, that's lupus. These and all these symptoms all have that. When you see anemia, you're going to be, the same symptoms are going to be like weak, tired, no energy, okay? And also probably short of breath. AS, ankylosing spondylitis. That's an inflammatory response, causes degenerative changes in the vertebrae. So where you've got the in between the vertebrae, the cushion, the disc, that starts decreasing and decreasing, and then you've got the vertebrae bone on bone. CFS, chronic fatigue syndrome, also called CFIDS. And this all kind of goes along with your Epstein-Barr, the mono, everything in there. The chronic fatigue kicks in. EBV, Epstein-Barr virus, is linked with mononucleosis, which is mono. And it's also called the kissing disease. This is contracted by saliva. So when you're kissing and you've got somebody that's got mono, you're going to get it. Acute is an acute infection. It's not chronic. Symptoms are sore throat, fever, fatigue, and enlarged lymph glands. So that's why, they look under here and you can feel them. Another term is GVHD, and it's graft versus host disease. Complication of bone marrow transplantation. Lymphoid cells from donated tissue cause damage to skin, liver, GI tract, and other tissues. And you can see some of this maybe on your skin. It's discoloration. If you're having some liver involvement, of course, you're going to turn yellow, and your sclera is going to be yellow. So this, the bone marrow transplantation has to do with the cancer. And I had a friend of mine, and it's been probably 10 years ago now. He had a bone marrow transplantation, and he had it done at University of Florida, and he had to stay in isolation for a long time, for months. And then he was able to finally go home, and he and his wife had to be very, very careful with their surroundings. And so it was, I would say it was almost like a year before he was able to really get out. And he's been living a normal, happy life, and just, you wouldn't know he had been so sick. Hodgkin's disease, Hodgkin, and I always pronounce it with a plural, but it's Hodgkin disease. And the other name is Hodgkin lymphoma, and it's lymphatic cancer. Non-Hodgkin lymphoma is a group of 30 or more types of malignancies of B and T lymphocytes. So those are the special cells, the white cells, that they can diagnose as being non-Hodgkin. Okay, so the B and the T lymphocytes. Lymphosarcoma is cancer of the lymphatic tissue, not related to Hodgkin disease. So all very confusing. And the only thing I can say is with the lymphosarcoma, of course, they do it by biopsy, that if it says that it's non-related to Hodgkin disease, or it is not Hodgkin disease, then it's lymphosarcoma. Pernicious anemia. Many elderly people have pernicious anemia, and it's chronic form of megaloblastic anemia. Megaloblastic anemia. And look at what that says. Mega. What is that? Okay, that is large. The blast are the new red cells. Okay, so anemia, and this is caused by the deficit of absorption of B12, vitamin B12. So usually you'll hear them say, "Oh, I have to go get my B12 shot today." Also, pernicious anemia, and it is chronic. It's not acute. It is chronic. it happens in after people have had abdominal surgeries, and this involves the intrinsic factor in the intestines, and we'll get into that when we do the GI tract. But it usually people that have had abdominal surgeries end up having pernicious anemia, and they have to have the B12 shots. Phagocytosis is specialized white blood cells engulf and destroy microorganisms, foreign antigens, and cell debris. So remember, the phagocytes are the buzzards, and phagocytosis is where they come in and they eat all of this stuff. Okay, so they are the buzzards of the immune system. Polymyositis is, and the short is PM, and excuse me for kind of fumbling across that, but it is kind of hard. Causes slow onset of muscle weakness and pain in the muscles of the trunk, and progresses to affect muscles of the neck, the shoulders, the back, the hip, and possibly hands and fingers. So, like, it sounds like it's like from the hip area up, where you're not able to hold yourself up. So, pneumocystitis, carny, pneumonia. Okay, so let's say it again. Pneumocystitis, carny, pneumonia is pneumonia associated with AIDS, and this is like the end stage of it, and this is sad. Scleroderma, group of autoimmune diseases that cause inflammatory and fibrotic changes to skin, muscle, joint, tendons, cartilage, and other connective tissues. I've known one lady who had this, and it's terrible. And she had tips of her fingers that just fell off. It's a horrible, horrible disease, and it's a chronic disease. Sjogren's syndrome, SS, autoimmune disorder that causes dysfunction of the salivary glands in the mouth and the lacrimal glands in the eyes, and affects other areas of the body, also known as Zika syndrome. So the Sjogren's syndrome, just remember that it does affect the mouth, okay, the salivary glands, and then it's also the eyes. Your eyes are going to be dry, okay, so it affects that. SLE, this is systemic lupus erythematosus. The lupus is a terrible, terrible disease. It's a chronic autoimmune disease, and it's inflammation and degeneration of various connective tissues and organs. Transfusion incompatibility reaction to antibodies present in transfused blood to RBCs in the recipient's blood, or of the antibodies in the recipient's blood to RBCs in the transfused blood. I know we do blood typing. We try, and a lot of the caution that we don't have reactions to blood transfusion is taken very seriously, but it still can happen. And the nurse has to stay with that patient for like a half an hour, I believe, and monitor them very frequently for their blood pressure, for fever, for itching, any of that. And as soon as that starts, they have to stop the blood transfusion and then infuse normal saline. Transplant rejection. For a person that has any sort of organ transplant, heart, lungs, kidneys, whatever, they have to take medication for the rest of their lives to not have a rejection issue. But it still happens. And I have a dear friend that had a son who was healthy, didn't smoke, exercised and everything, had some sort of lung condition. They feel like after they did a lot of investigating and researching that he was probably born with it, but he had to have a lung transplant. And he ended up having rejection after about 1.5 years. And it all happened during COVID, so it was very difficult. But they do have to take a medication for the rest of their life. So some of the common diagnostic tests and procedures are the patch test. Is a test in which paper or gauze is saturated with the allergen and is applied to the skin beneath an occlusive dressing. So, and then they watch for any sort of reaction. Scratch test, the test in which an allergen is placed on a scratched area of the skin and the response is noted. So they used to do it on the back. I see sometimes they do it on the arm. CD4 lymphocyte count is measurement of the number of specialized white blood cells called helper T cells used to identify whether a person's HIV infection is worsening. So this is when, if the count is down, then they say, oh, it's getting worse. So you need to, be careful. Like I said, when you've got the killer T cells or they come in and they're like the snipers, but you've got these helper T cells also. And they call it the T cell count. The enzyme immunosorbent assay, EIA, it used to be called the ELISA. And this is one test that was common with testing for HIV, but it's also for syphilis and any of these enzyme-linked immunosorbent diseases. Viral load, measurement of the number of copies of the HIV in the blood, used to monitor progression of HIV infection and AIDS. Erythrocyte sedimentation rate, ESR, or we also call it the SED rate. And it will show, if it's elevated, it's going to show that you have inflammation. And this can be with anything. So it's a pretty accurate test. Monospot heterophil, that is your mono test, and it's a quick test, and they can see if you've got the mono and also the Epstein-Barr virus, and which is the monovirus. So the last few slides are questions on these diagnostic tests or procedures. So I want you to go through them and know them, okay? So if you have any questions about anything, let me know. You need to go through this PowerPoint and do your assignments. And your assignments can also be taken. You can go back through the PowerPoint and look for the answers also.